go. So my topic, which I'll be talking to you guys about, is Commotio Cordis. The reason I picked this topic particularly is because this is a little bit more in the realm of something that I would see as an athletic trainer, but if you work in exercise physiology, something you could possibly see if you work with like youth sports. So let's get started. First thing, talk about is a case study. So one of the ones I found was on a 14-year-old rugby player. He was playing rugby. As he was running, it took an elbow to the sternum, right in the chest, and he collapsed on the ground. Upon evaluation, when they came up, they checked his vitals. He was lacking a pulse. He was lacking respirations. So they initiated CPR right away with chest compressions and a two-valve bag mask, which I don't know if you guys have ever seen those, but essentially you just kind of place it on. It's a one-way barrier, and they have a giant bag that you squeeze, and it's one way of doing this instead of doing like actual breaths yourself. 911 was called, and they arrived within 4 minutes after the incident occurred, and they did attach an AED. For those guys who don't know what an AED is, it's an automatic external defibrillator, in case you guys don't know, if you've ever seen them. And when it read you attach it, and it looked for rhythms or abnormal rhythms in the heart, and what it read was a ventricular fibrillation. So that was, once it read that, the person who was missing was discharged, and the person who suffered with Commotio Cordis kind of came to. He was sent to the hospital, and upon arrival at the hospital, his blood pressure was 133 over 66 milligrams of hydrogen, and his heart rate was at 130 beats per minute, which is just vitals. I didn't really see much along like certain vitals along case of Commotio Cordis, but it's just what he happened to come across was. He was discharged on the 7th day, and he only suffered mild hand-eye deterioration coordination, so nothing major, which was good. He was allowed to go back to school 2 months after this incident, after release from the hospital, and like on back of follow-ups, he was actually playing rugby again. So that's your very, you don't see this a lot. It's a high mortality rate of Commotio Cordis, so the fact that this person is continuing to play rugby is very impressive, and he's very lucky for that. So my research question was kind of based more, again, like from my view as an athletic trainer, how can you prevent something like this, something that has such a high mortality rate, something that you don't see a lot, but it is out there and it's becoming more and more prevalent within sports today. So quickly with the etiology, it generally calls from blunt force to the chest, whether it be a baseball, an elbow in like the rugby case, any other kind of projectile, a punch. You can see them in car accidents. Everything depends. This is a weird kind of situation because it's almost like a perfect storm of events have to happen for this to occur. It has to be at a certain time in the heartbeat, stuff like that. It generally is caused during the upstroke of the T wave. I have here, one article said 10 to 30 milliseconds before the T wave, but it's generally on the upstroke, which is consistent with all the research I read. And it generally can cause ventricular fibrillation from the heart. So if you're at an event where this happened, you see someone, say you're at a baseball game as a catcher, he gets drilled with a pitch or a tip ball if a bat hits him in the chest, they'll generally walk around for a couple seconds. They'll be okay, they don't have a grip in their chest, and all of a sudden they'll just go down without any kind of warning. When someone goes up, they won't have respirations, they won't have a pulse, they'll be, nothing like that. And like I said, it generally causes ventricular fibrillation. So that was what, like, if you touch an AD, like, that's what you would read. It's more prevalent in males, for whatever reason that is, and it's generally more prevalent in young athletes, which you'll see on another side. I have one of our researchers talk about that. We'll see more about that. So as far as prevention and treatment, stuff that you can look out for. One thing I talked about was chest wall protectors, which you see catchers in baseball and softball wearing. Lacrosse, they have like the shoulder pads, football and stuff like that. But that isn't always the most effective thing, as you'll see earlier on too. After the event happens, CPR is important you start right away, and the quicker you get an AED on the person, the higher their survival rate shoots up, which is really important. And one article talked about education, which might seem kind of like a weird topic, but they talked about just kind of having the athletes, like explain to athletes what this is, how it's something that can happen, teach them ways to avoid getting hit in the chest. If it's something like mixed martial arts, showing ways to protect yourself from being hit in that certain sport, stuff like that. So education is maybe a more far-fetched kind of prevention technique, but it's something that, education with anything will definitely help. So it was really tough, believe it or not, to find any research articles on human subjects, because I guess they didn't want, that might be an ethical issue, getting hit in the chest, possibly killing somebody. So one particular one, which has a lot to do with where getting hit would cause an issue, is they use swine models. They essentially took a baseball, they took a bunch of little pigs, they took a baseball, and they hit these pigs in the chest, different locations on the chest, generally over what they call a cardiac silhouette, which is roughly where the heart lies on these pigs' chest, and a couple other spots like on the side, stuff like that, to see if they could cause commotio cordis in these models, just to see like if this transfers over to human. If someone gets hit when you're making pads, you want to protect that certain area. So if it's not as important to have protection here or here as it is right over the heart itself. With these models, they found that most of the commotio cordis was caused when hit over the cardiac silhouette. So what I have here is 7 chest wall sites, 3 over the heart. Ventricular fibrillation was only caused when hit over the heart. So which just helps shows back to my question about prevention, if chest wall barriers were something that was prevalent, it would be necessary to make sure that you cover more over the heart than on the sides. Also, impacts over the left ventricle more likely to cause the ventricular fibrillation than any other location on the heart, which again just goes to kind of chest wall barrier importance when you're protecting someone. This other article, a lot of the articles I found talked about the Commotio Cordis Registry, which is something that started in 1997. This was as of 2001. They dug and they got some information to try and another way educate athletes and people about it. It was shown that out of 128 cases of in the U.S. Commotio Cordis Registry, 44% were under the age of 12, as opposed to 22% and another 2% that were over the age of 18. So that just kind of shows that a vast majority of commotio cordis is much more prevalent in younger athletes than there is older athletes. They do tend to, you can see it with elderly people or people our age or people in like the 30s, 40s, but it's just much more common in younger athletes. 62% of these cases were during sporting events, and 58% of these sporting events occurred during baseball or softball, which is where, like I said earlier, like a pitch, get hit in the chest. Though the other cases were cases where there were accidents, car accidents, fights. A lot were like fights, people got punched in the chest, stuff like that. 81% of the cases also involve some kind of projectile, like I said, like a baseball or a cross ball or anything of that matter. Back to the high mortality rate, 84% was a result in death, which, like I said earlier, that's the case study. That's very impressive. That person's still playing rugby when you have an 84% chance that you're not going to make it out of that situation. And then of the 79 individuals participating in sports, 28% of them were actually wearing chest protectors, which shows that that's not a complete foolproof technique in preventing these kind of cases. So to answer my question earlier, throughout the research they showed different techniques of chest protectors. They talked about different types of chest protectors, whether it be cell foam, where it kind of more absorbs and distributes the force, as opposed to like hard body chest protectors where it's like a thick plastic, or just a thicker, harder, where it's more, it doesn't really absorb it so much but deflects it. But it shows here that even with the chest protectors, you still have a decent chance of causing commotio cordis, which shows that chest protectors aren't really a foolproof plan. You can make bulkier ones, but if you're catching baseball and everything, a lot has to do with mobility, and that's going to be an an issue. You're going to take away the mobility to have more protection, and that might not be ideal for a lot of sporting events. So preventing it is tough. I mean, it doesn't happen a lot, but the biggest thing is how you act, or preparation in case it does happen. Secondary prevention was what was mentioned a lot of articles. So secondary prevention includes CPR, AED, having AEDs available at most sporting events, especially youth sporting events. You might not see that a lot where youth baseball games go on. They're out and you just see a lot of baseball fields all over the place, and there's no real central location where you can have an AED, anything like that, where you can run to and get it. That's an issue. That shouldn't really be the case. Having a certified athletic trainer at youth sporting events, I'll put my own little 2 cents here, would definitely be a big help. At least, or not even at certified athletic trainers, but someone who's trained in using AED. AEDs are very easy to use. They pretty much open it and tell you how to run it. But having people who are trained in using them, people who've used them before, that's something that can be done, and something that should be pushed for youth sporting events to help prevent this issue. So, is this something that can be prevented? It is, but not as well as it could be. The secondary prevention is much more important, I think, than the primary prevention in this case, where chest wall protectors just don't always do the best job. But how you act after that is definitely going to be a bigger effect than what you do, I think, before. These are my references, and do I have any questions?